Hello, and welcome to UW Boise. My name is Mike Krug, and I'm going to walk you through some of the highlights of our quality improvement and patient safety curriculum here at UW Boise. At UW Boise, we think that exposure and experience with quality improvement and patient safety techniques and attitudes is absolutely crucial for all of our graduates. Whether our graduates are going into primary care medicine, hospital medicine, fellowship, whether they're going to be full-time clinicians, whether they're going to do teaching, whether they're going to do research, administration, quality improvement teaching and techniques are absolutely crucial. We are lucky to have a robust curriculum here, spanning all 3 years of residency, R1 to R3, and actually even an optional 4th year chief resident year in quality and safety for those who want. One of the highlights and things I'd like to point out to you is that the vast majority of our curriculum is interprofessional. So our neighborhood for quality and safety teaching includes not only our internal medicine residents, but trainees from other professions as well, including nursing, nurse practitioner, physician assistant, pharmacy, psychology, and psychiatry, all working together to make the care of our patients and our training experiences as best as they can be. Here is an outline of our quality and safety curriculum here at UW Boise. Starting early in the R1 year and going all the way through the R3 years, we have both Pacticu, which will be described by Dr. Wepner himself, he's the leader of that. And we also have population health management, where residents get data on their practice patterns and patient outcomes that they can use to modify their practice. In the R2 year, we have the 9-month-long interprofessional quality improvement project curriculum and work. We call this IQUIP. I'll describe this a little bit later on. In the R2 year, there's an optional QI elective. Dr. Osterkamp will describe this briefly. In the R3 year, we have our root cause analysis sessions. There are 10 of them. We call this Resident Peer Review Conference. This will be described by Dr. Inoa. In the R3 year, we have a patient safety workshop for the first time this year. That's when we go through some elements of just culture, error reporting, and great patient safety attitudes. And finally, the R4 year, we have an optional chief resident in quality and safety position here at the Boise VA. We've had this for the last 2 years and it will be ongoing. And Dr. Osterkamp will describe this briefly.
Hi, my name is Bill Wepner. I'm the director of the Continuity Clinic site here at the Boise VA and also the physician lead for what we call Pacticu. Pacticu is an interprofessional case conference for high-risk, high-need patients. We all know that patients in continuity clinic settings can be very complex and have behavioral as well as psychosocial and medical issues which make it difficult to care for them. So to address this, we've put together a curriculum in which we have a collaborative workplace conference featuring trainees and attendings from psychology, nursing, nurse practitioner, pharmacy, as well as internal medicine to help to develop a comprehensive coordinated plan for patients in continuity clinic moving forward. And in the research that we've done and published, it shows that not only do trainees have improved knowledge and comfort in taking care of such patients, but there's better team engagement and there's better patient outcomes in the form of decreased ER visits and hospitalizations.
We don't do old school finger pointing, demoralizing morbidity and mortality conference here. We do resident peer review committee where we use a practical framework to analyze errors and help you fix the Swiss cheese holes in your practice and more importantly in our system and help you do good catches for your patients.
Perhaps the cornerstone of our quality improvement and patient safety curriculum here at UW Boise is called IQUIP, which stands for Interprofessional Quality Improvement Projects, and it is a full curriculum. So this starts in September with a full half-day workshop talking about quality improvement principles and terminology. Then in October, residents are matched with an interprofessional group of trainees, a mentor, and a project that they ranked highly. They'll then work with this team on their project over the next 9 months. From October to May, they'll work on the project with help from their mentor, of course, and they'll present their work at lunch conference twice in works in progress sessions. Then in June, they'll present their final work and outcomes at grand rounds at the Boise VA. After June, many of our trainee teams disseminate their work at regional or national meetings. Just to outline the training programs that are included in IQIP: internal medicine, of course, nurse practitioners, pharmacy, psychiatry, psychology, psychiatry, and registered nursing all send their trainees to participate in mixed profession groups in IQIP. Here's an example of one of the IQIP projects from last year. This is a group that created from scratch a framework for providing virtual shared medical appointments to patients with new diagnoses of diabetes. If you look in the top right of this slide, you can see the schedule for these sessions. They're about 60 minutes long, and these were led by the trainees and with interaction from the patients. And the goal was to engage and inform veterans of the factors that led to their diabetes and continue to lead to their diabetes, and best practices in diabetes management. And you'll see that in this project they had 7 patients involved, and if you look at the right, they actually showed a meaningful improvement in diabetes-related quality of life via a validated survey instrument, which was pretty cool. I'll also tell you about a project from the year before, which was focused on streamlining post-discharge lab and visit follow-up for patients with congestive heart failure. This group actually partnered with a pharmacy-led congestive heart failure clinic, and they were able to increase significantly the number of patients seen in this clinic per month. They were also able to increase the number of patients who had lab draws done and provider follow-up visits within 2 weeks. So before, in the early days of their project, that was around 60%. And then as their project reached full form with multiple interventions, they got that up to 80 to 100%, which is a big success. And they were also able to show that they reduced readmissions through this work, which is of high interest to both patients and administrative folks within the health system. And lastly, this is a photo of a few groups who have decided to disseminate their work at a regional Northwest Society for General Internal Medicine meeting.
So here within our residency, we are very lucky to have the opportunity to participate in quality improvement, where we monitor, analyze, and review the processes that ultimately go on to improved patient care. One of those opportunities is that as a senior resident, you can take part in an elective quality improvement block where you are teamed up with a mentor and develop your own project that hopefully ends up in actual improvement in the hospital processes right here where you do your training. You also have the opportunity at the end of your residency to do a chief year in quality and safety, where not only where you get to do the traditional chief year duties of teaching residents and attending on wards, but also get to participate in quality improvement, including teaching the QI block and interacting with those that are in the leadership here to hone and perfect the quality improvement projects within the hospital itself.
Thank you very much for listening to this video. Have a great day, and we look